All right, good morning, everybody. Thank you all so much for joining us. We're going to get started here. Today with us, we have Doctors Hayley Russel and Dr. Lucie Holmgreen. Dr. Russel completed her PhD in kinesiology with an emphasis in sport and exercise psychology at the University of Minnesota. And her research interest centers on psychological predictors and responses to sport-related injury, long-term health, and physical activity in former athletes, and physiological adaptations to marathon training. And Dr. Lucie Holmgreen completed her PhD in clinical psychology from Marquette University in Milwaukee. Dr. Holmgreen's research integrates both clinical and social psychological approaches. Her work studies trauma and attachment while taking a particular interest in the emotional, cognitive, and behavioral reasons for the cyclical nature of trauma. Additionally, she is interested in the ways institutions respond to individuals' traumatic experiences and the way these responses impact mental health. So thank you both again so much for being here with us this morning. We really appreciate it. And with that, I will turn it over to Dr. Russel and Dr. Holmgreen.
Thank you, Emily. So I'm going to start this morning. I'm Hayley Russel, and Lucie and I are both professors at Gustavus. So as Emily said, my background is in kinesiology with an emphasis in sport and exercise psychology, whereas Lucie's background is in clinical psychology. So we sort of share some expertise in both sport and clinical psychology. So this morning we're going to talk about two distinct and related topics. So I'm going to start by talking about supporting student-athlete mental health, and then we're going to switch to talking about supporting coach mental health, which Lucie will take over, and then we'll save about 15 minutes at the end for any questions you might have. So feel free to send questions along as we're speaking. So thank you all for joining us this morning.
Thank you.
See if we can get the slide to advance. There we go. Okay, so when we think about student-athlete mental health or mental health of anyone, mental health exists on a continuum. So in sport, particularly in sports psychology, we spend a lot of time on the right side of this graph where we want to talk about peak performance. So we want to talk about how we help our athletes be confident. We want to talk about how we help them focus and how we help them perform at an optimal level. But really, we know that a lot of athletes are not in a position to be able to work on peak performance. They're somewhere else on this continuum of mental health where they may actually be experiencing an active mental health condition or subsyndromal illness, meaning that they're having some symptoms of a mental health condition, like in particular anxiety or depression, but may not meet the criteria for clinical diagnosis. So what we're going to talk about today is how we recognize athletes who may be in distress relative to active mental health conditions or subclinical symptoms of mental health conditions. And then what we can best do as people that work in athletics to support athletes and encourage them to seek the appropriate help that they need. So it used to be that, particularly in the 80s and 90s, there was research that supported that athletes were actually had better mental health than a general student body population. Over the past 20 years or so, that has changed. So increasingly, athletes are demonstrating symptoms of mental health conditions, reporting symptoms of mental health conditions, and being diagnosed with mental health conditions, or mental illness. And part of the reason why this seems to be the case is that the context of sport actually puts them at additional risk. So now research will tell us that athletes have about the same level of psychopathology or mental illness as the general student body population. And in some studies, it's actually been found that athletes' mental health is worse than the general student body population. And that can be related to the context of sport. There are many unique stressors and situations that student athletes are placed in sport that general student body doesn't have to deal with. So for example, there's the constant pressure of sports. So not only are student athletes managing the stress and pressure of academic performance, but they're also managing the pressure of performance in sport. and training living up to their own expectations and the expectations of those around them. We also see that the training load in sport, which research has found ranges greatly for different sports and different schools, but anywhere between 20 to 40 hours a week of training, film, competition, is an added stressor for athletes that the general student body doesn't deal with. And that can be taxing both physically and psychologically, and then also force them to make tough decisions about things like how do they manage their time while wanting to perform well in school. Athletes report a high level of stress, in part because of these additional time commitments that sport has. There's also some research suggesting that athletes who identify strongly as an athlete often do so at the expense of other identities. And so when they identify really strongly as an athlete, particularly when that identity is challenged, so when they're injured, when they're not getting a lot of playing time or not getting a lot of positive reinforcement from those around them, that can be linked to negative mental health. And then lots of sports have some unhealthy behaviors that may increase the risk of psychopathology. So for example, sports that require or are perceived to require weight control can lead to some really negative behaviors surrounding dieting and exercise, and some additional stress and risk of things like eating disorders. So generally what we know is about 1/3 of undergraduates, students will screen positive for a mental health condition, and the numbers are pretty similar for student athletes. And I will say the research hasn't been great. It's hard to collect this kind of data, and as we'll talk about a little bit later, athletes seem to be quite reluctant to report mental health concerns. So I'm just going to go through a few warning signs of potential mental health or mental illness concerns that coaches may witness in their athletes. So we know that coaches are a key source of social support for athletes, and that they spend a ton of time with athletes. So you may be one of the first people that's noticing some of these concerns. And I've put these in the form of a stoplight, and these are from the Chatham University resources, and I have those resources at the end of this PowerPoint, and they're really good at helping explain some of the risk factors for athletes, identifying some of the warning signs if athletes are in distress. So high risk warning signs would be things that you want to really make a priority. And some of these, it's very clear. So if an athlete is making comments related to suicide, that supersedes anything else that's going on, and you're looking for ways to best support them. And that may look different in different situations, but you're getting them to a mental health professional or to a physician, or calling campus safety if you think the concern is really imminent, but certainly staying with them and supporting them and getting them appropriate resources. Other things could be things like indications of self-harm, extreme variations in mood or extreme changes in mood, expressions of excessive or irrational worries or fears. And then you may see other things like rapid weight change or reports of poor eating and sleeping. All of these could be linked to major mental health concerns. And then there's things that might be a little bit more nebulous, so some yellow lights. And they're to a less extreme than those red light behaviors or warning signs. So it may be that athletes seem to be having trouble concentrating, losing interest, are really negative, anger, maybe missing practice or school, or you may notice or suspect drug or alcohol use, or you may see performance declines. So with these situations, you want to be reaching out to athletes with expressions of support and trying to direct them to appropriate resources. And those may vary on your campus, but it may be that they go to the athletic trainer and get directed to a physician or to a psychologist or the counseling center. But you want to make sure that they have someone with appropriate training that is going to help them to manage some of these concerns. You also may see athletes that are engaging in adaptive coping behavior. And this is really good. So they're doing things like reaching out to you, reaching out to an athletic trainer, reaching out to teammates, or trying to learn additional resources that can help them. Although this is all really good behavior, we do want to make sure that our athletes are reaching out to the most productive sources of help. So even if an athlete is talking to you, talking to an athletic trainer, if they're expressing concerns about depressed mood, excessive worry, or other things that may indicate that they are suffering with perhaps psychopathology, then you still want to be encouraging them to seek appropriate counsel, particularly from counseling center, psychologists, or community resources. So we care about mental health because it's important for our athletes to be both physically and mentally well for their own well-being, for the well-being of our team. But mental health can also impact sport performance. Mental health has been clearly linked to physical health. There's some really interesting research that finds that when athletes are at high levels of stress and or anxiety, they're actually at higher risk for getting injured, for example, but it's also associated with things like gastrointestinal problems or problems with being at risk of getting sick. It also can challenge athletes' motivation. So if an athlete is experiencing symptoms of depression, they're certainly going to be struggling with also not only just getting out of bed in the morning, but then having to perform in a high-performance sport. So that could be a real challenge. Athletes who are experiencing concerns with mental health may also struggle with focus, risk of injury, as I said earlier, and may struggle with decision-making, in part related to focus, again, because their attention is not where we would want it to be if they were not experiencing the type of symptoms. So as I've said, it's really important that athletes get to a place where they can receive appropriate care and support. But athletes report higher levels of barriers to help seeking than any other population of college students. So athletes are highly reluctant to seek mental health support, particularly going to see a counselor or a psychologist, in part because of stigma. So athletes report that they think that their coaches have a high level of stigma, and this is their perception. It may or may not be true, but research has consistently shown that athletes perceive their coaches to have high levels of stigma surrounding mental health, so may see mental health as a weakness or something that threatens them as an athlete or something that they should just work harder and persevere through. Athletes, as we talked about, have a lot of time commitments, so they may lack time to seek mental health. And I know that it's a common concern on college campuses that there's just there's not enough staff in the counseling center, and so maybe a long wait time or very few options of when an athlete can go in to seek help. Athletes may lack knowledge about the benefits of going to a counselor, psychologist, or have misconceptions on what that will be like. So for example, it may be that they think that one session will fix the problem, so to speak, and so may not understand the investment that goes in, or what will happen in a therapy session. And we also find that athletes, as many studies have reported, report negative past So there's a couple of things that we can do as people that work in athletics to create an environment where athletes feel comfortable to talk about mental health and where then coaches can have productive conversations about how to best seek help from an appropriate professional. So generally, we want to work on creating an environment where athletes can talk about mental health. And one way to do that is to be really careful with language surrounding mental health. So it can be effective to talk about mental health the way you talk about physical health. So if you're struggling with an injury, you go to see an athletic trainer. If you're having symptoms of stress, anxiety, depression, then you go to see a psychologist. So having those conversations together, and also be careful to not use dismissive language surrounding mental health. So sometimes we say things like, when someone is really particular, we may casually call them OCD. Or if someone is moody, we may call them bipolar. And this doesn't create an environment where mental health seems to be taken seriously, or where an athlete may feel that they can express concerns about mental health and be taken seriously. Generally, we all know this is good coaching behavior, but build rapport with your athletes. That doesn't mean you should be your athlete's best friend. We all know that that's probably a really terrible idea. But you can express concern about athletes outside of their sport, their school, their friendships, and their well-being as a whole person. And then generally engaging in active listening. So if an athlete does come to you with concerns, you're listening carefully and reflecting back to them what they're saying. And you don't necessarily need to problem solve the concern in that moment. Rather, just express that you are an invested person in hearing what they have to say. If you have to approach an athlete about their mental health, one of the best things you can do is be really specific with behaviors that you have witnessed. So rather than saying, I have heard, try to be specific with things you have seen. So I seem to think that you are not as motivated as you used to be in practice, or you seem really angry when you're in practice, and provide specific examples. Rather than saying, a teammate told me this, or an assistant coach told me this, it's easier for athletes to get defensive in those situations and to sort of counter what you're saying. And always framed as concern. So if you're having a conversation with an athlete about mental health, you may actually be quite frustrated with the behavior they're exhibiting. But if you are concerned about mental health, the best way to approach this is framed as concern rather than punitive or angry about the behavior that you've seen. Focus on the benefits of seeking help. So if, again, going back to the example of physical health, if you had an injury, you would seek a physician or an athletic trainer or physical therapist to support you through that injury and to give you the best strategies to improve that injury. And the same is true if you are having mental illness symptoms. Provide pragmatic support. That may mean helping them make an appointment at the counseling center, showing them where the counseling center is, or providing specific recommendations of a professional that they might see. And the other thing that I would say from an entire department perspective, researchers have found that one of the most effective things that you can do to encourage athletes to seek mental health is to have relationships with healthcare providers in athletics. So the number one thing you could do is hire a psychologist in the athletic department. We know at D3 that is almost never the case, but it almost doubles the rate of athletes seeking mental health support if there is someone in the department. Since that's pragmatically probably not going to work for almost all schools, the next best thing is to bring in a member of your counseling center frequently to athletic department meetings, to teams, have athletes be familiar with them, particularly if they have a strong interest in sport. And this can familiarize the athlete a little bit with this person, and also allow the professional to learn more about the context of sport to better support athletes. So now I'm going to switch over to Lucie, and she's going to talk about coach mental health.
Hi, thanks for being here today, or possibly for listening sometime in the future. It turns out that we don't know a whole ton about coach mental health. We know more about athlete mental health. We know some about what I would probably call coach well-being. So if you remember that slide that Dr. Russell showed early on about sort of the continuum of mental health and mental illness, I'm going to talk about sort of the area hovering in the middle. So issues of stress and burnout especially. Coach well-being, of course, hopefully matters to the coaches themselves. It certainly matters to their families, to their health, etc. But it turns out that coach well-being probably matters also to coaches' athletes in some pretty important ways. So there's evidence that coaches who are high in burnout, which I'm going to talk a little bit more about in a second, are perceived by their athletes as providing less training, less instruction, and less social support to them. They're perceived as using less praise and more disparagement. They're perceived by athletes as communicating less effectively in general and displaying less empathy. And athletes who perceive those behaviors in their coaches report lower perceived competence, so they see themselves as less competent. They report lower enjoyment of their sport. They report greater burnout themselves. In other words, coach burnout seems to be able to lead to athlete burnout through a number of pathways. And athlete burnout can be seen in characteristics like more negative self-concept, greater emotional and physical exhaustion, and more feelings of devaluation. In other words, coach burnout is not good for anybody, coaches or athletes. And while these data are still correlational at this point, they certainly suggest that watching for coach burnout is a good place to start when thinking about coach well-being. There are a lot of threats to coach mental health. This will probably not surprise any of you. It turns out research does indicate that coaching is really, really stressful. Coaches experience a wide range of strong stressors relating to their athletes' performance, relating to their own coaching performance, and relating to the organizational context that they're operating within. And also personal stressors that are related to coaching, like the strain on a marriage of constant travel. I will let you read these words yourself. These are words of real coaches. And my guess is that at least a few of these look and feel familiar to you. This is just a smattering, as I said. In addition to these kinds of stressors, it turns out coaches tend to have low job security. They work long hours. They work within a results-oriented culture that puts a great deal of pressure on the results of their coaching. All of this can increase the chances that coaches experience burnout. And what I mean by burnout is a combination of three characteristics. The first is emotional exhaustion. This is approximately what it sounds like. This is not a very fancy term. It really just means feeling that you don't have the emotional resources to deal with your situation, feeling emotionally overextended or fatigued. It also includes something called depersonalization. That's when you really emotionally distance yourself from your athletes. So you may feel yourself sort of closing off or shutting down, providing unfeeling or impersonal responses to your athletes that you wouldn't normally. That's a sign of burnout. And the final element of burnout is reduced personal accomplishment. So this refers to experiencing a reduced sense of meaning in your work, not feeling as competent in your work as you once did, not feeling like you're achieving successfully. It's not fun to go to work anymore, and it doesn't feel meaningful. So if we put all those together, we have what is traditionally known as burnout. So what is it that coaches can do? There are a lot of things coaches can do, and it actually looks a whole lot like what athletes can do that Dr. Russel already talked about. So one thing that I would recommend is maintaining healthy boundaries with athletes. And as Dr. Russel mentioned, what does that look like? It may vary based on context, but it involves acting like an interested and caring adult in your athletes' lives, but who is not their parent, right? So you should not be involved in your athletes' romantic relationships, probably. That would be a kind of a boundary issue. It involves also not being athletes' friends, right? The coach relationship is not the same as a friendship. It probably involves not taking on responsibility for an athlete's entire well-being. Healthy boundaries may also involve personal practices like deciding for yourself what you're comfortable with regarding your availability to your athletes. Owning and sticking with those boundaries of access are important to coach well-being. So For me, for example, just as a professional, that means not checking my work email right before bed. That's just a quick thing I can do every day that helps me maintain good boundaries with students. There are, of course, a number of ways that you can cope actively with stressors. So if you imagine for a moment that you have a team with a bunch of conflict happening, so your athletes are sort of at each other's throats, maybe that's impacting sort of the general team climate, and you're worried that it's also negatively affecting team performance. One way to cope with that, of course, is to directly try to deal with the situation. Coaches are good at this, right? This is one of the primary areas of their job. So that might involve talking with the athletes involved and sharing your concerns, sharing your expectations for their behavior going forward. But there are also many other important ways to cope with a stressor like that, especially given that you can only reasonably control so much. One of the most important ways of coping is something called cognitive reappraisal, which is a sort of fancy way of saying thinking about things differently than you are. It turns out that the way you perceive a stressor may actually be more important than the stressor itself in determining its effect on you. So people who have a tendency to view unexpected change as a challenge or opportunity rather than as a threat are less susceptible to burnout. In other words, the way you think about things can greatly affect your emotional and behavioral response to those stressors. Your initial thoughts about this conflict on your team might be something along the lines of, you know, this team is tearing itself apart, these kids need to grow up, etc. And if you find that you're incredibly stressed out about the situation, there are very likely other ways of thinking about it that might be either more realistic or at least more helpful to you. Some examples of a cognitive reappraisal of that situation might be something like, the fact that my athletes are experiencing tension about how to move forward is a sign that they care deeply about how our team does. Or maybe these athletes are in a stressful situation themselves and they're struggling with how to behave like adults. Or perhaps you look at this as a great opportunity for you to grow in your ability to manage team conflict, right? This is a great opportunity for me to really work on this skill. And maybe even focusing on how it might turn out to be a great opportunity for the team itself to come together and grow. So those are just some examples of different ways of thinking about what at first appears to be a threatening situation. Another type of coping is emotion-focused coping, which is when you just try to change your emotional response to something. This involves trying to make yourself feel better or self-soothing. This is one of my favorite ways of coping, and it often involves watching a favorite movie and eating ice cream or something of that nature. Just trying to make yourself feel better for the moment. That's important to do every once in a while. Social support involves talking to supportive others. A quick warning here, you may need to tell the supportive others that you don't want suggestions about how to solve the problem, but rather you just want someone to listen to you. That's what good social support looks like. Unless, of course, what you are looking for is advice, and then you might want to tell them that's what you're looking for. Relaxation and a healthy lifestyle. Taking good care of yourself is just good emotional maintenance. I like to think of this as sort of analogous to getting your car an oil change every now and then and rotating the tires. This is not going to fix a major problem with your transmission, but it's going to make your car less vulnerable to those big problems. And similarly, taking good care of yourself physically and taking time for some downtime and relaxation, getting enough sleep, all of those things will help keep you less vulnerable to negative emotion, to stressors, right? If you're eating healthy, you're getting exercise, and you're getting enough sleep, you're much less at the whim of a stressor or a negative emotion on any given day. And finally, knowing warning signs. These are the same as the warning signs that Dr. Russel talked about. So if you're noticing in yourself a lot of stress about your job, maybe talking to a sports psychologist if you have access to one, or another mental health professional if you're seeing some of those warning signs that Dr. Russel talked about in your own self. I'm going to turn it back over to Dr. Russel as a wrap up, and thank you so much for having us.
Okay, thank you. So that's all we have for you all today. So I just put a couple of things that might be helpful here. So the Chatham University modules about student-athlete mental health, I think, are really good. And the NCAA Sports Science Institute has some nice resources as well. And then Dr. Holmgreen and I have had a student athlete, Maggie Leineger, who's a soccer player at Gustavus, working with us on this work over the past year. So we want to thank her as well. And now we understand that Zoom has the function that you can, that we can see some questions that you might have, and we'll have a look through those and answer any questions that might be helpful if we can figure out how to do that.
Yes, so thank you again to Dr. Holmgreen and Dr. Russel for that wonderful presentation. At this time, we welcome all of you to place questions you might have into the chat function, and you can send it directly to Dr. Russel or Dr. Holmgreen to maintain anonymity, or feel free to send it to the entire group, or you're more than welcome to ask it verbally. That being said, just to kind of go over a couple things that you both presented on, what are some of the most, I know you guys mentioned multiple coping methods for both student athletes and coaches. In your experience, what are some of the more effective methods that you have seen specifically for coaches? Because that's who we have on the chat right now. What have you all found to be the most effective coping mechanisms?
Yeah, so as Dr. Holmgreen said, there's really limited research on this, so I'll sort of speak to it anecdotally. I think the coach boundary piece is huge. Coaching is a job that can be completely all-consuming, as you all know, but that is not good for you and not good for your athletes. So trying to be really intentional with how you spend your time with your athletes, and when you are not available to your athletes, what you are not able to do, and what sort of relationships you have with your athletes in terms of how invested you are in various aspects of your life. Their life can be really important. I think the other thing that's really important to recognize is that if you are experiencing consistent negative emotions, so whether that's anxiety, whether it's negative mood, it is really good and evidence-based to seek out a mental health professional. And so if it's sort of stress that comes and goes and you feel like doesn't negatively impact your functioning in your life, then that might be something you can manage on your own. But it is really important that if it seems like it's negatively impacting your relationship with other people, if it's negatively impacting your ability to coach and your enjoyment and satisfaction in coaching, then it may be a valuable use of your time and resources to seek some professional help.
And I would add from the sort of wider literature of clinical psychology that there really is no best coping style. So coping behaviors turn out to be incredibly variable among individuals, but also highly context specific. So the example I give my students is if you're failing a course and it's halfway through the semester, probably your most effective coping strategy is going to involve one of those problem-focused coping strategies like trying to solve the actual problem, studying more, going to talk to your professor, etc. However, if it's a night before the final exam and you're failing the course, that's not going to be a very effective coping strategy. And what's probably actually going to be more beneficial is cognitive reappraisal, like I didn't need this class for my major anyway, or making yourself feel better, calling your mom, etc., etc. So the type of coping strategy that's most successful depends a lot on sort of how much control do you have over a situation at any given time, and what sorts of resources do you have at your disposal. And when I say resources, I mean both sort of outward physical resources, but also internal psychological resources. Which is not maybe the most helpful answer, but it's an accurate answer, I think.
Fantastic. So we do have one question to everybody on the group chat, and I'm not sure if Dr. Holmgreen and Dr. Russel, if you've received any directly to you, you can see that in the chat function. Yep. On the lower bar. But the one that was to everybody, do you all have a decision-making model on when to withhold student athletes from participation based on where they fall on that continuum?
Yeah, that's a really good question, and a question I get from coaches a lot. I wish we did have a clear decision-making model, but a couple of criteria that I think can be helpful. One is it safe for them to be participating? So this becomes very clear with things like eating disorders. There are points in which it's unsafe for student athletes to be participating. And this might be a conversation you have in other mental health situations as well, with the physician, the team physician, or the athletic trainer. The other thing that I think is that we all want to be really empathetic when athletes are experiencing distress. But if an athlete is continuing to exhibit really negative behavior, so for example, anger, over and over again in a way that makes it difficult for you to do your job, makes it difficult for athletes to, the other athletes to participate or enjoy the experience, and the athlete is not taking any steps to improve the situation after you've had conversations with them about seeking mental health care, then you also have to think pragmatically. Even though you want to be empathetic, would you tolerate this behavior without any effort to change in another athlete? So you may sort of think about, is me allowing this player to play really enabling them to not seek any support because they're still able to participate in their sport? So thinking about every avenue you have to try to encourage athletes to seek professional support. And if they're not doing that, thinking about, would you tolerate this behavior without any other effort to change in anyone else? So you just don't want to be reinforcing not seeking help by allowing them to continue to play. But sort of my number one decision-making motto would be, is it safe for the athlete to be participating? And I don't know if Dr. Holmgreen wants to add or interject anything.
No, I feel good about that answer for
Thanks.
sure. Yep, I agree.
This is Dan McCain with the MIAC. Have either of you received any questions directly?
We have not, unless we don't know where we're seeing them.
No, I think you're probably looking, it would pop up.
Yep.
One of the things that, I've been around for a while now, and mental health has been a really big topic that's grown over the last several years, and I'm glad we're addressing it, and I think a lot of campuses are. Just one of the things that I know we have coaches, we have administrators on here. We are doing a mental health seminar for administrators on April 15th. And so that'll be an opportunity for us to continue the conversation, which I think is going to be really important. And we recognize that coaches may not necessarily be trained in this, but they're going to be that first responder at times. And so we want to be able to build support mechanisms and making sure that our administrators know how to handle when these types of situations arise on campus. So I'm glad that we're doing this. It's going to be a continued effort on our part as a conference. And so I'll welcome now any other questions from participants on the call today.
And I'll just add one thing to what you just said, Dan, that sometimes when an athlete chooses to disclose a mental health concern to a coach, you're going to feel way out of your element. As professionals, sometimes we feel way out of our element when really personal and difficult things are disclosed to us. So sort of just like basic best practices, if you feel like you have no idea what you're doing, thank you for sharing this with me. I'm glad you feel like you can. I'm going to do whatever I can to support you. And that you don't need to have all the answers. It's really helpful if you have some resources readily available, but if you don't, just validating that experience for them and validating that you're glad that they shared with you and that you don't think it's silly or ridiculous or don't think negatively about them can be some of the most effective things you can do.
Mm-hmm. Fantastic. All right. Since we do not have any further questions, I think we are going to wrap it up and leave it at that. I want to take one more minute here just to thank Dr. Russel and Dr. Holmgreen once again for their work and their presentation to all of us. We greatly value your emphasis on this work, and mental health is a huge importance to us in our conference. So thank you so much for all your work on this, and thank you for taking the time to speak with us all today. Have a wonderful rest of your week, everybody. Thank you very much.
Thank you so much.
Very much.